It is the year 138 AD. You are lying on a narrow bed, inside a room with stone walls that hold the scent of burnt herbs and sweat. Daylight enters through a single crack, drawing a golden rectangle on the packed earth floor. Outside, Rome pulses with life. The cries of the vendors, the clatter of carts on the paving stones, the murmur of the aqueduct that runs like a tamed river above the heads of 1 million people. But you can't really hear any of that. You have a fever. Heat rises from your chest, making your vision tremble, and every breath comes with an effort you never noticed before. Someone calls for the doctor. And this is where the story starts to get interesting, because the question that few people ask is this: what really happened when a sick Roman met his healer? What did this man in a toga carry in his hands, in his words and in his mind as he approached a suffering body? Was Roman medicine just a collection of superstitions and senseless cruelties? Or was there something more, an internal logic, a system of ideas that made sense within its own time? The answer will surprise you, because Roman medicine was not simply ignorance. It was something much more complex, much more human, and at times much darker than we imagine. To understand where Rome arrived, we need to go back a little further. For centuries, the average Roman did not distinguish between illness and divine punishment. Falling ill was a message from the gods. If you woke up with aching bones and an upset stomach, your first action was not to call a healer. It was to make an offering. The temple of Asclepius, the god of medicine, was located on an island in the Tiber River, and the sick would go there, shuffling their feet, hoping for a revealing dream, a sign, a miraculous cure that would come from the sacred sleep within the halls of the god. Imagine this place. Marble columns shrouded in morning mist, the scent of incense mingling with the fragrance of the river, bodies lying on straw mats, waiting for nightfall and dreams. The priests would interpret what each person dreamed, and from that extract the prescription. Was it medicine? Was it religion? For the Roman of that time, this distinction did not exist. Body and spirit inhabited the same territory, and to heal one without caring for the other would be like trying to repair only half of a bridge. But Rome also knew how to import. When Greek doctors began arriving in the city, first as slaves, then as free and respected men, they brought with them a different tradition. Hippocrates, who lived about 400 years before Christ, had proposed something revolutionary for his time: that diseases had natural causes, not supernatural ones, that the body functioned according to laws that could be observed, described, and perhaps controlled. The Romans heard this, absorbed it, and mixed it in. The result was a system you would never call modern, but one that had its own coherence. The theory of the four humors. According to this view, every human body was governed by four fundamental fluids: blood, phlegm, yellow bile, and black bile. Health was balance. Disease was the excess or lack of one of these elements. And every treatment, every herb, every bloodletting, every diet aimed to restore this lost harmony. You might look at this and think, how absurd. But wait, because within this logic, the Roman physician was rigorous. He observed, he took notes, he compared cases. Galen of Pergamon, who lived in the 2nd century AD and became the most influential physician of the ancient world, wrote hundreds of texts detailing symptoms, disease progressions, and treatment outcomes. He was methodical in a way that very few of his contemporaries could match. And his mistakes, and there were many, did not stem from intellectual laziness. They arose from the limits of what was possible to know at that time. So you are lying on that narrow bed with a fever, and the doctor finally arrives. He is a man with steady hands and a calculating gaze. He examines your tongue, presses on your abdomen, smells your urine. Yes, he smells it, because the color, odor, and consistency of urine were fundamental diagnostic windows for the Roman doctor. He observes the color of your skin, the moisture of your lips, the rhythm of your breathing, and then he makes his judgment. You have an excess of blood. your humor is unbalanced. This needs to be corrected, and this is where the comfort ends, because the most common, widespread, and long-lasting treatment in Roman medicine was bloodletting, the deliberate removal of blood from the patient's body through cuts in the veins or by applying leeches directly to the skin. The reasoning was simple within the theory of humors. If there is an excess, remove it. If the blood is in the wrong amount, reduce it. The problem is that fever, weakness, and infection already consume the body. And removing blood from someone in this state was often just accelerating their decline. Imagine the scene. The leeches arrive in a small clay container. They are dark, moist creatures that move with an almost hypnotic slowness. The doctor applies them to the skin of the neck, the wrist, the abdomen. They latch on and begin to work. The patient feels their coldness, then a tingling sensation, then nothing, because the leech's saliva contains a substance that slightly numbs the area. The doctor waits, observes, and considers this not a torture, but a precise and rational intervention. This contrast is at the heart of everything Roman medicine represents. Real intelligence applied to mistaken premises, producing results that ranged from genuine relief to irreparable harm. But not everything was bloodletting and leeches. Rome also had its pharmacies, the tabernae medicae, where rows of ceramic jars held substances from the most diverse origins. Mandrake roots used as a sedative, capable of inducing a deep sleep before painful procedures. Opium extracted from poppies, which relieved pain with an efficiency that no common herb could match. Honey applied to wounds. And here, interestingly, the Romans got it right, without knowing why, because honey has antibacterial properties that modern science would confirm centuries later. There was also vinegar used to clean instruments and wounds. There was olive oil applied to inflamed skin. There were poultices made of clay mixed with herbs, placed on fractured bones or swollen joints. Some of these practices worked, others were harmless, and some caused real harm, such as the use of lead compounds, which the Romans used both in cooking and in medicine, without suspecting that the metal was slowly poisoning their bodies from the inside out. The Roman surgeon deserves a chapter of his own, because here the contradiction deepens. Archaeological excavations throughout the former territory of the empire have revealed sets of surgical instruments of impressive sophistication. Steel scalpels with blades as thin as leaves, speculums for examining internal cavities, articulated forceps, needles for sutures, saws for amputations. The technical skill was there, the precision was there. The problem was what didn't exist: knowledge about infection. Every Roman surgery was a crossing over an invisible abyss. The surgeon could suture a wound with admirable skill and kill the patient 3 days later, because the bacteria that entered along with the scalpel would spread without anyone knowing what they were or how to fight them. There was no concept of sterilization. The instruments were sometimes cleaned with water and vinegar, which helped but not enough. Post-operative death was so common that there was almost a collective resignation in the face of it. And here comes a dimension that few consider: the brutal inequality within this system. The wealthy Roman had access to trained Greek doctors, imported medicines from Egypt and Persia, and prolonged care in homes with ventilation and clean water. The poor Roman, and most people were poor, depended on street healers, traveling potion vendors, prayers in temples, and the resilience of their own bodies. Curiously, the Roman legions had something that the average citizen rarely experienced: an organized medical structure. Each military unit had its own doctors, called medici, and the camps had infirmaries, the valetudinaria, where wounded soldiers received reasonably systematic care. There were protocols, there was hierarchy. Within the limits of the time, there was something that resembled a functional field medicine. A legionary wounded in battle, paradoxically, had a better chance of surviving with care than a merchant who fell ill in the city. This contrast says a lot about Rome, an empire capable of organizing armies with geometric precision, building aqueducts that defied gravity, codifying laws that would influence the world for 2 millennia, and yet, at the same time, unable to understand why people died from minor wounds, from childbirth, from infections that today would be resolved with a few days of antibiotics. Roman medicine was a faithful mirror of Rome itself, grand in structure, limited in foundation, unequal in distribution, and fascinating in its complexity. Let us return to you on that narrow bed in the year 138. The doctor has finished his work. The leeches have been removed. An herbal paste was applied to your forehead. A bitter drink, probably a mixture of absinthe, honey, and boiled water, was placed at your bedside with precise instructions on when and how to take it. The man left through the door with the same seriousness with which he had entered. And you were left alone with your fever, your weakness, and a question he could never answer. Will this work? The honest truth is that it depended. It depended on the illness, on your physical constitution, on luck. If the fever was caused by a simple virus, your own immune system would probably win, with or without the doctor. If it was something more serious, like typhoid fever or malaria, the odds were already different, and the treatment, in most cases, did not tip the scales in your favor. Sometimes it made things worse. It's important to pause here and resist a very human temptation to romanticize the past. It's easy to look at Roman medicine with a sense of distant admiration, as if there was some ancient wisdom hidden in every herb and every ritual. But the numbers don't allow for this romanticization. The average life expectancy in Rome hovered around 25 to 30 years. Not because people aged quickly, but because infant mortality was devastating. Children died from diseases that today are preventable with a simple vaccine. Women died in childbirth at rates that today would be considered a humanitarian catastrophe. Common infections killed young, healthy adults within days. Roman medicine saved some lives, eased some pain, and organized the chaos of suffering into categories that made sense to those who created them. But it also killed. It also failed. It also left entire families at the mercy of diseases that no one understood and that no scalpel or leech could fight. And yet, and here is the insight that changes everything, the effort mattered because what Rome did, within its limits, was to build a tradition. Galen wrote, Celsus systematized. Dioscorides catalogued hundreds of medicinal plants in a work that remained a reference for more than 1,500 years. These men made huge mistakes, but they also created something that had not existed before them on this scale. A written body of medical knowledge, transmissible, questionable, expandable. When medieval Europe inherited these texts, often preserved by Arab scholars who translated, commented on, and improved them, it did not inherit only mistakes. It inherited an embryonic method. The idea that diseases can be observed, described, and treated systematically, that the human body follows principles that reason can, at least in part, grasp. That medicine is a practice that can improve over time. This idea, which seems obvious today, was not obvious anywhere in the ancient world. And Rome, with all its therapeutic brutality, with its leeches and its lead compounds and its dream-based diagnoses, helped to plant this seed. Think about the contrast with what came before. In older cultures, illness was exclusively the domain of gods and demons. The healer was a spiritual intermediary, not an observer of the body. Roman medicine, especially that influenced by the Greeks, began to shift its gaze from the heavens to the patient. It began to ask not only which god is angry, but what is happening in this specific body at this specific moment. This change in perspective took centuries to bear real fruit. And the fruits only came after many other revolutions. The discovery of microbes, the invention of modern anesthesia, the development of antibiotics. But each of these revolutions needed a foundation to grow. And part of that foundation was laid by men who examined urine, applied leeches, and believed, with all the seriousness they could muster, that they were helping. There is something profoundly human about this. The attempt to heal, even without the right tools. The urge to do something in the face of suffering, even when what is available is insufficient. Every Roman doctor who bent over a feverish patient was doing the most that his time and knowledge allowed. And this honest effort within the limits imposed by history is what connects these men to every doctor today who enters a hospital room with instruments they could never have imagined. Medicine advances because each generation inherits the mistakes of the previous one and tries to correct them. The Romans inherited from the Greeks. The Middle Ages inherited from the Romans. The Renaissance questioned the Middle Ages. And so knowledge was slowly, painfully distilled over centuries of trial and error, of deaths and discoveries. You are alive today, if you are reading this in a part of the world with access to modern medical care, because an endless chain of people made mistakes before you. Because someone, at some point in history, had the courage to try something different from what had always been done. Because dissatisfaction with what doesn't work is the driving force behind everything that eventually does work. Roman medicine was not efficient. It was often cruel in the most literal sense of the word, not out of malice, but out of ignorance of the consequences. But it was human. It was a response to the universal fear of illness and death. And within that imperfect response was the seed of something that, 2,000 years later, would save billions of lives. From the narrow bed, smelling of burnt herbs, to the surgical room, with white lights and monitors tracking every beat of your heart, there is a line. Winding, interrupted, full of detours and setbacks, but a continuous line, made of human curiosity that never gave up on understanding the body it inhabits. If this video made you see the past differently, leave your comment down below. Tell us which part surprised you the most. Like the video if you think this kind of story deserves to be told, and subscribe to the channel so you don't miss the next documentaries. Here there's always a story you didn't know you needed to hear. And speaking of which, the next video will take you inside another forgotten world. You won't want to miss it.